Hello there. You know, our health is important, and with that in mind, I've invited David Boucher, CEO of Bumrungrad International Hospital, Phuket and Market, to come and join Trends for Today. We're at the wonderful Ritz-Carlton Residences Bangkok at Mahanakorn Tower, and you are watching Trends. David, can you share with us the history of healthcare in Thailand and Bumrungrad's role?
Sure, yeah, I'd be happy to. So today, healthcare and hospital care in Thailand is primarily governed by the MOPH, or the Ministry of Public Health. There are a number of other agencies affiliated, not at the ministry level, in Thailand and stuff. So back in 2002, Thailand adopted a universal health coverage package. And interestingly enough, according to the World Health Organization, today they estimate that about 99.5% of all Thais are covered by some level of coverage and have access to healthcare, which is actually pretty phenomenal. I think we're in one of the top countries worldwide and everything. Today in Thailand, there are, I think, 927 public hospitals, I think 368 private hospitals. And so, as you might imagine, the quality and access to medical care, to hospital care in the inner cities in Thailand is much more available and readily accessed than it is in the rural areas and stuff. So that's an issue for us and something that confronts us and stuff. So in terms of Bumrungrad, our story goes back 43 years, in our 44th year now. So Bumrungrad International Hospital was actually founded and started back in 1980. So we're relatively new when you think of the 1,000 years of Siam history here. We were relatively successful treating predominantly Thais and began to attract international patients. Then at about the time of the Asian financial crisis, the leadership at the time had to come up with some idea, some way to get patients into Thailand and into our hospital that were not paying Thai baht, that were different currencies and everything else. At the time, I understand we had bonds we needed to meet and everything else, responsibilities, and so we did that. And so if you think in terms of concentric circles around Thailand, first Myanmar, Vietnam, Cambodia, Laos, and then around, that's predominantly where our patients, non-Thai patients, originated. And now, of course, here we are, 25 years after that, and today we treat about 1.1 to 1.2 million patients a year from about, on a regular basis, from about 190 countries and territories from around the world. So it's a pretty amazing place if you think about it. And truly, it's the United Nations of healthcare. I'd invite you at any point, and any of our viewers, to come and actually have a coffee. We were one of the first hospitals in the world to actually have a Starbucks, pro or con, in the world. And so come and sit and have a coffee in the main lobby and just observe. And it's a moving experience. It really is. So yeah, so that's our role. So we again work with people from all over the world on a pretty regular basis.
That's a significant patient base that you're handling, basically, isn't it?
The whole world is our oyster. Absolutely. So on a regular basis, we treat just over 12,000 international patients a week for 52 consecutive weeks in a year, especially when we look most recently at 2023. So significant numbers. And the complexities that go with that, it's time tested, of course. We one of the first hospitals in Thailand to offer telemedicine services. So now it's relatively common, pre-travel, post-travel, your surgeon's available to you, your doctor's available. We try to do that ahead of time. So we do a lot of the planning with the patient ahead of time. We have a patient reception kiosk at Suvarnabhumi Airport. We meet with hundreds of patients a day. We have a fleet of vans that are on the road from 7 in the morning till 11 o'clock at night. From a logistics perspective, bringing them either to their hotel in Bangkok or to the hospital, and then carrying people, between places and things. So yeah, it's a pretty amazing. We have over 200 full-time interpreters on staff, and we have an absolute professional team of doctors and nurses, about 25 of them, that are our medical intake area, medical screening area and stuff. And on a regular basis, we receive over 3,000 emails a day and over 3,000 phone calls a day from all over the world, 24/7. We're operating and just fielding questions, first opinions, second opinions, making appointments, whatever it might be. So it's a pretty remarkable story when you look back. Clearly, I'm pretty convinced of it, Thailand is by far and away the medical tourism hub in the world. And again, as you're aware, Bumrungrad has some level of competition in this space at this point, but it bodes very well for Bangkok and for other areas, but for Thailand specifically. So as you might imagine, we work very closely with governmental entities, public and private entities as well, and want to make their experience as accessible and affordable and acceptable as we possibly can.
Now, you're based in Phuket, which is where I met you recently.
Correct.
Does Bumrungrad International Hospital have a presence in Phuket? And is there a growing healthcare market for Bumrungrad on the island?
Yes, yes, and yes. All three of those. And so, you're absolutely right. So we've known for about 25 years that we've had a demand for clinical services, to have clinical services physically in Phuket, whether it be a multi-specialty clinic or a hospital. So the numbers are going up. And the day that you and I met, you recall, I think today, if I recall, there are 53 separate airlines that are flying nonstop into Phuket. Yes. A phenomenal number, the envy of the world, truly. There's so many other, there's nobody in the Caribbean that can boast any place close to this. So it is pretty remarkable. The numbers, we think post-COVID, so we compare a lot of things to 2019, of course. 2023 was a pretty big year. We're all anticipating, the TAT and certainly folks in the healthcare sector, that 2024 is going to be a remarkable year as well. So the answer is yes. And we see a growing need. We know statistically every year from a clinical perspective the types of patients that are flying from Phuket and the region, not just Phuket, but Phuket, Krabi, Surat Thani, Phang Nga, and point south of that of us, that we know why they're coming to Bangkok, why they're visiting us and receiving services at Bumrungrad. And so we're going to respond to those needs, absolutely. So the decision's been made to build and we're in the process of building a 240 six-star boutique hospital on the north end of the island, about exactly 2 kilometers from the airport parking lot in Phuket.
Fantastic.
And so again, here in Bangkok, about 60% of our patients are non-Thai, and we expect the number in Phuket to be north of that for a number of reasons, of course. Today, back in 2022, we opened a referral office in downtown Phuket town. We were providing some level of telemedicine visits there, but a lot of really instruction. People were curious, they'd come in wanting to know, they'd been a patient for Bumrungrad for years, what the function was. We help facilitate their travel. We can make appointments right there in the office. We can help with their travel plans and everything to try to eliminate any barrier, any impedance. It might be somebody, an expatriate who's living in Phuket, who's got visa issues. We try to work directly with them and the people in Thai immigration to facilitate whatever quandary they might be in. And so yeah, that's worked out really well, and the community has responded in a pretty big way.
Is AI, there's a lot of talk about artificial intelligence and digital disruption. Is it impacting the medical sector, the healthcare industry? Do you see that in your operation at Bumrungrad?
I think that AI will at some point. Clearly, one of the first applications would be in reading radiologic images, so diagnostic imaging. So, and in a way, when it's referred to as artificial intelligence, you have to think. I mean, if you look at Siemens, GE, and Philips, the big three in imaging, they have literally hundreds of billions of scans that humans have read. Physicians, board-certified physicians around the world, radiologists, have interpreted and QC'd and everything else. And so, that's one of the first. And we've implemented some level of AI in diagnostic imaging at Bumrungrad back a couple of years ago. We still rely on the human being to make the the diagnosis and the interpretation, but they have that to fall back on as well. So, I think, I often muse to myself, I go in every now and then to ChatGPT and say, what stock should I buy today when the market opens? And it's yet to give me the right answer.
Yes.
So when it's ready for prime time, then we'll go. So, but we're paying very close attention to that, as you might imagine. And just a couple other notes about Bumrungrad. I mean, we were the first Joint Commission accredited hospital in all of Asia. Joint Commission is the American hospital accreditation program based in Chicago, and they accredit probably 5,000 of the 5,500 hospitals in the U.S. But at the time, I think Bumrungrad was first in all of Asia, not just all of Thailand. We were one of the first hospitals. Our laboratories was accredited by the CAP, the College of American Pathologists, back a few years ago. And so we're a body in motion, and we are biased towards action. So the Bumrungrad, I think, in Thai means care for the people.
Yes.
When we've done consumer research, what most of our patients equate the name Bumrungrad to is the word trust. And so, they're counting on us for that, and we want to do a really good job. So, we're not satisfied. We are an environment of continual quality and service improvement. And, we keep achieving higher and higher numbers, say in the Newsweek top 200, 250 hospitals worldwide. But we're not complacent. And we know that generally complacency is the #1 problem with successful organizations worldwide.
That's right. I see you as the market leader, as the brand and as a hospital. And being up there, there's often only one way to go, and that's down. So it's good that you're on the game and you realise that, hey, we need to continually up the game to stay there. Absolutely. As the market leader.
Absolutely.
Now, why Phuket? What brought you to Phuket and what brought you to Bumrungrad? When I thought about that question, I actually went online and I was astounded. You have launched some major medical programs in the US that had profound impact on millions of people with their Medicare. Having had that incredible success, how on earth do you end up at Bumrungrad and in Phuket?
Well, great questions both. Quite by accident. So I was a military brat growing up. My father served for nearly 30 years. And so as a child, I spent 4 years growing up in Germany, 4 years near Madrid, Spain, and went to international schools and stuff. And myself and my 2 older sisters, as we've grown, we've maintained that level of curiosity. I'm particularly interested in international commerce, global commerce. Not so much on a macro level, but how consumers pay for things, what they buy, how they buy it, and how merchants sell. So it's spending a day at a market in Samarkand, Uzbekistan, which is one of the cornerstones of the Silk Roads, of course, over the years. And back in 2006, I finished reading a book by Tom Friedman called The World is Flat. And the next week, I heard about this trend called medical tourism. And long story short, I talked to 3 friends of mine that work in international healthcare consulting, one with McKinsey, one with KPMG, and one with Deloitte. And I said, look, for the 4th of July week, Independence Day week in the US, I want to do 2 things I've never done before. I want to do what the Dalai Lama suggests is visit a new country, and I want to check out medical tourism. Where should I go? Should I go to South Africa? Should I go to Dublin, Ireland? Should I go to Mexico City? And independently, all 3 contacts said Bumrungrad International in Bangkok is where you should go. So I reached out, went to the Bumrungrad website, said, contact us, please forward this to your CEO. No idea who it was. All I knew was the Bumrungrad website. And the next day, I got an email. I received an email back from the CEO, and he and I both had worked in the United States for similar companies back in the 90s, and we didn't know each other, but we knew a lot of the same people in the space. And we did about a week later, we did a Skype call. Remember Skype back in the old days? And 9 a.m. his time in Bangkok, 9 p.m. my time in the U.S. And we spent about 30 minutes on the phone. And I just said, I'm curious. I'm Assistant Vice President for Healthcare Services at Blue Cross Blue Shield of South Carolina. And he said, come on over. So I had never been to Asia before. I had no idea what flying 32 or 33 hours in coach was going to do to my much younger body at that time. I came over and I literally spent I spent 5 days at Bumrungrad behind the scenes. I of course signed a privacy statement, but I was able to gown up and go into surgical procedures. I talked to doctors and patients from all around the world and was amazed. And I fancy myself a service snob. And so, but some of the things, and a relatively innovative, disruptively innovative hospital CEO was on the US, and I saw things, I experienced things that Bumrungrad was doing on the service side that I had never even thought of. Low cost, very incredible things. And that was it. It was an incredible holiday. That was it, 5 days. Went back to the US, got into a conversation with the president of Blue Cross Blue Shield of South Carolina where I work, and he said, tell me about your holiday. And he was at the gym on the treadmill reading The Economist magazine, and I regurgitated this story like 8 minutes, 10 minutes nonstop about, he thought I was going to talk about Buddha's beaches and brothels, and I just talked about Bumrungrad. I told him this incredible story, and he never stopped walking. And he said, that's it, that's a blue ocean for us, that's the next big thing. I want you to start a company, develop a network of international hospitals, and we're going to start outsourcing heart valves and hip replacements. And I said, you're going to pay me what I'm making to travel the world and visit hospitals and do this. He said, yeah, we're going to do it. So we did it. We started a company called Companion Global Healthcare, to your question.
Yeah, that's right.
And so we started that at the end of Q4 of 2006. And the media picked up on it and went literally insane.
Yes.
Because what's a stodgy, conservative, if you know insurance companies, it's all about mitigating risk, identifying what the risk is and mitigating it. And what's a stodgy Blue Cross plan doing outsourcing hospital care to places like Bangkok, Thailand, because Bumrungrad was our flagship hospital, or Costa Rica, or Seoul, Korea, or Kuala Lumpur, or Singapore, wherever. And of course the question was asked, don't we have the best and safest hospital care in the world in the United States? Knowing, of course, that only 30% of Americans will ever have a passport. 70% have no interest in leaving the United States. And the answer to that question is no, we don't. 25 years ago, America may have had the best and safest hospital care in the world, and certainly we have pockets of great care. The Mayo Clinic, the Cleveland Clinic, Johns Hopkins, MD Anderson, Duke Medical Center for transplants, but on average, we've lost our superiority in the United States. And so it's a compelling story. And having been a hospital executive, hospital CEO for a number of hospitals in the US, the media couldn't punch holes in it. It just was, and it wasn't the intent. It wasn't the intent to create some kind of a media storm, but it did. And so just on a pretty regular basis, I think I've been quoted in easily over 300 magazines and newspapers, from the Wall Street Journal to New York Times. I think The Economist 3 or 4 times, Business Week.
I could see that when I put your name in on the Google and the information and articles that came out.
So it's worked out well. So our focus was to work directly with self-insured employers, help them to change their benefit plan to start outsourcing hospitals. So they're quite, you can't, employers would ask, how much money are we going to save? Well, the answer is, how aggressive do you want to be? The patient can save a huge amount of money on that. So, yeah.
David, thank you so much for being with us here today. It's been a joy to hear about Bumrungrad, the history of healthcare, the new future of Bumrungrad in Phuket. And thank you for watching Trends. If you like the conversation, please like and subscribe, and we'll see you next Friday.